look at the tray, okay?
Okay.
White tray, extraction tray.
Mm-hmm.
Okay. And the way that we set up for extraction is you open up the packages. These are all the materials that you are going to need for basic extraction. Don't forget eyeglasses.
Safety.
Mask.
Yes, ma'am.
Gloves. Patient bib for patient. Always get blood pressure. Consent form for extraction. Consent forms are right here.
Yes, ma'am.
Blood pressure machine is in room 3, okay? Patient file, okay? You must take out x-rays. Should I show exactly where to put the BP and stuff like that, or do you
No,
you want
it's
that?
good. It's good.
Okay.
I know
When
exactly.
setting up for extraction, we set up anesthesia first, okay?
You don't open it. Do you open? You gonna open it? Okay.
Open it is, that's how you can see the instruments. Extraction kits for single tooth to multiple teeth have the elevators to take out the teeth. Okay? So for her side, for anesthesia, we take out the syringe, mirror,
Yes, ma'am. Got it.
Explorer, cotton pliers.
Got it. Over here.
Topical, lidocaine,
Perfect.
long needle. Dr. Grigo likes to use long needle, but there is short needles in the anesthesia drawer, which are blue. You got your disposables. You got air water tip. Surgical suction. High speed suction. Saliva ejector. Okay. High speed fiber optic handpiece
That is important.
with surgical burr. 550, I believe it's a 556. Surgical burr. Okay. You can assemble that as well.
Oh my goodness, you're
Push
awesome.
button. Make sure it's in there nice and tight. Set it up on your high-speed coupler. Snaps right in.
Done.
And then you cover it. You cover it with the package it came in. Just in case, you don't have to use the high-speed handpiece. It doesn't get cross-contaminated. And we can wipe it down and use it for things. Okay. So, on your tray, you have your Minnesota, which is your cheek tongue retractor. Your Periosteal Elevator.
Yes, ma'am. Got it.
Your elevators. It's 2 through 5. 3, 4, 5. Dr. Grigo likes to start with number 3. Use 3, 4, and 5. 2 is just in case. Curette.
Got it.
Looks like a spade. Extra stuff that you get out during surgeries is a Selden. It is used for, Dr. Grigo uses it for retraction of the tissue. A rondure. This is to clip bone, to clip tissue. It's for cleanup afterwards. Q3D bone file, which is a square bone file.
So we have different sizes?
We have different shapes.
Shapes.
But she prefers the Q3D one, the square one. Number 15. This is a blade holder. This is the size of the blade, which is a number 15. So we refer to it as number 15. And a suture needle nose, hemostats, and surgical scissors. They come in a pack together. Located where it says post-op hemostats and scissors.
Okay.
On the left side. Okay. Sutures, silk sutures, which is the blue one. It's located under alveoplasty kit. Right here. Okay. Extra number 15 blades are in here. Extra sutures are in here. Usually extra number 15 blade holders are in here. As well as usually we have extra bone files in here. So,
Got it.
okay.
That's
So
pretty much it.
when setting up your anesthesia, you have to have this ready for a doctor. Okay. You pull back on the harpoon.
You don't want to waste. Do you want to waste?
No, it doesn't matter. Drop it in and let go of the harpoon.
Don't tap it. That way you don't.
The needle, pretty much, I'm not going to waste the needle, but
Okay.
you twist it open. There's a little seal on it, so you can determine whether it's been used or not. So if it hasn't been used, it will be intact. You twist it open, you line it up with the little hole on the end, and then put it in. Now, the way that you put the anesthesia, the lidocaine, there is a plastic rubber tip there, and the top part is where the needle goes into. So make sure to put it in the right way, okay? This one is actually for the harpoon to kind of grasp onto. So you drop it in this way, okay? Small little end goes towards the little part right there. So, and then once you put the needle in, you tap it.
Yeah.
Okay. Topical is located in this little thing right here. Extra topical is in the back. Open it. You don't need much. Just kind of scrape it. Put it on. Depending on how many teeth, how many sides, we put topical per quad. So this right here is Septicane. She uses that if the patient doesn't get numb. She can use different kinds of anesthesia to get them numb. Okay. So that's Septicane. Lidocaine is usually located in here. Okay. So.
What about this one? Same.
Yeah, that's just different kinds of anesthesia she could use.
Okay.
So when she starts doing the procedure, she numbs up the patient first. She gives it about a good 15 minutes. In the meantime, you can give up post-op instructions. We have a little container in the back here that has post-op instructions. Now, these instructions are very important for extractions or any kind of surgery to prevent the patient from developing dry sockets or hurting the area that we pull the teeth out of. So, things to say when you're doing post-op instructions is no smoking, no drinking through straws, no carbonated drinks, no eating anything hard or crunchy. The patient will be numbed up for several hours, so you want to make sure to tell them not to eat anything until it wakes up. Not to eat anything hot because they won't feel it. Not to do a lot of chewing because if they bite themselves, they won't feel it. until it wakes up. They're going to be like, what happened? So, extra gauze for extraction site. And your post-op has extra gauze inside. When they leave, you pretty much, she'll pack in gauze, but you can do it too, depending on how big the site is. You can just put it in there, have them bite down. Tell them to bite down for 30 minutes. Take it out in 30 minutes. They have to apply pressure. Take it out, see if it's still bleeding. Extra gauze in here, fold it up, pack it in there, another 30 minutes. Bigger gauze are in the bottom drawer. We got 4x4s for big surgeries. 3x3s. Okay. Miscellaneous has extra Minnesotas. Bite blocks. If the patient keeps closing during extraction, she can use a bite block to kind of keep it open. Monojets. This is mainly used when she wants to rinse out the area with chlorhexidine rinse, which is an antimicrobial mouthwash and kills all the germs. So when she says, I'm going to do a rinse of chlorhexidine, pretty much you get a cup and you put a cupful of this, dump it in there, fill this up, and hand it to her, and she'll rinse. Sometimes she'll just rinse with water. And this is just to kill all the germs and to take out all the bone fragments out, so no the bone spurs will be popping out during healing time, or prevent healing. So, disposables, if you need more disposables, they're located under the disposable drawer. Extra or water tips, extra surgical sections, anything extra right here. Anesthesia, if she needs another long needle or more gauze or another hot tip applicator, they're right here. Okay. So once she gets the patient numb, then that's your time to tell them about the post-op instructions if you haven't done it already. Once she comes in and she's ready to start, you start off with the Periosteal Elevator first. This retracts the tissue from the tooth and prepares it for the elevators. The elevators are only used if there are teeth next to the teeth that you're going to extract to elevate from. If it's a single tooth, if it's a loner, sometimes she'll just go to this and then the forceps. The forceps are located over here. Extra rongeurs, extra Seldons, root picks, extra elevators are located in this drawer. Now we got upper and lower forceps depending on what tooth you're going to pull. If it's an upper, then we have different ones that you choose from. Okay, canine to canine, you use the number 1, which looks like that. Premolars, or if the tooth breaks and she says she needs something small and skinny, it's a universal. 150 for uppers, 151 for lowers. 88. We have left side and right side. Okay, I have one. Okay, left side and right side. And they have the number on the end down here. So these are mainly used for upper molars. 1, 2s, and 3s. Okay. All the other forceps, she will pick them out herself if it's not those 3 basic ones, okay? Or 4 basic ones, yeah. Lower forceps, we have the 151, which is also universal. It's used for premolars and occasions where the tooth breaks and, she needs something small to kind of take it out. And a cow more, number 16. It looks like a cow here. And those are used for molars. 1, 2s, and 3s. And we had another one, which is a 74. And it's probably in the other room. I'll show you that.
Yeah, that's fine.
Okay. And those are used for anterior lowers. It looks like a bird beak, like this. Okay. So, when y'all do the Periosteal Elevator, you're handing it to her. You're suctioning the blood. And she's like separating the tissue from the tooth. Then you hand her the elevators, starting with number 3. Then number 4. Then number 5. Okay? Then once she's done with the number 5, you reach for the Forceps, whatever Forceps is for the appropriate tooth, or whatever, you know, whatever you need for that. Okay, you hand her the Forceps. Okay, she wiggles, she takes out the tooth. Assuming it came out whole, okay? You take it out, that 2 by 2, you grab the tooth, grab the Forceps, okay? Then you hand her the curette. She cleans up the area, the inside, okay? Then she'll ask for the rongeurs. And this is to clip out any sharp bone and any dead tissue, any cyst. She'll clip it off with this, okay? Sometimes she'll ask for the bone file if the edges are too sharp. She'll ask for the bone file. She'll ask for scissors as well. So you just take them out of your suture pack and you cut the dead tissue. Or she'll cut the dead tissue and you just suck it up with your high-speed suction. Okay? So when everything is done, everything's clean, assuming that she doesn't need any sutures, if she does, you just assemble the suture for her. Assemble it, hand it to her, she stitches, cuts, ready to go. You hand her the gauze. Oh, she'll rinse. I'm sorry. She'll rinse afterwards. She'll rinse all the blood off, you know. And then you can hand her the gauze or give her the gauze like this and she'll fold it up herself. She'll pack it in there. And then, after everything's said and done, the patient's good, the patient's okay, you sit them up. She'll continue to tell them about the post-op instructions, and then you get out your routing slip, which is this. You can get it out prior to the procedure, you know. This routing slip is just to kind of help us transfer a patient from op to front desk. And it also tells front desk person exactly what is needed next, like post-op, suture removal, antibiotics, or pain medicine. Okay? So you just write all that down. Okay? If you're not sure, ask Dr. Drago. Ask her, okay, what's next for the patient? Does he need antibiotics, pain medicine? Okay? Then you write it down. Okay? After everything is finished, you pack everything up, you throw everything away. Pretty much stuff it there. Anything that hadn't been touched or hadn't been used, you just wipe it down with a cavity wipe and put it back into the drawers for next procedure. Okay? Alveol bone files go in here. Number 15 is going here. Just wipe it down, put it back. Then just grab this. Any anesthesia that hadn't been used, you wipe it down, put it back. This one hadn't been used, so wipe it down, put it back. This one, since we didn't use it, I'll save it for the next procedure, next patient. Okay? Usually I just grab everything, put it on the tray, take the tray to the back. Take everything out, wipe everything. Everything, usually during surgery, you gotta wipe down everything. Check underneath, make sure there's no blood there, make sure there's no blood on the handles, make sure there's, especially like on this little part right here, blood tends to kind of collect right there. You want to make sure all of that is clean. These buttons here, usually under here, sometimes, you know, we'll accidentally grab it and we don't realize that we grabbed it underneath here with a bloody glove. Just make sure that that's clean. Any kind of stuff on the floor that looks red or bloody, you just want to make sure to clean that. Get it ready for the next patient. Okay?
Okay.